Intradermal medication administration. Let's learn how to do injections. Before getting started, let's review some safety precautions. CDC states washing your hands before preparing medication is a must. CDC recommends a wash period of 20 to 30 seconds, which is roughly the same amount of time it takes to sing Happy Birthday twice. Don't forget to scrub under those nails.
Happy birthday to you, happy birthday to you, happy birthday dear Miss Amy, happy birthday to you, happy birthday to you, happy birthday to you, happy birthday.
CDC also states that gloves are optional when performing an injection. For today's injection, we're going to glove up. Let's review what equipment you'll need when performing an intradermal injection. Start off with an empty tray. Place a blue chuck on the tray. Place the appropriate needle, the medication you'll be using, alcohol swabs to clean the site, cotton balls or gauze, and a kidney bean to place trash. You'll need a 26 gauge or 27 gauge needle, alcohol swabs, a kidney bean, gauze, and your medication. Before administering the medication, we will need to figure out which site we'll be using. For an intradermal injection, there are two sites available, the forearm or the mid-back. To locate the proper placement on the forearm, you'll find the center of the forearm using 3 fingers from top and bottom. For the back placement, you'll inject the medication in between the shoulder blades. Be sure to compare the doctor's order to the medication. After checking if you have the correct medication, you are able to draw up. Open your needle and be sure to aspirate the vial. Clean the top of the medication with the alcohol swab before entering your needle. 1 swipe is enough. Make sure to place your trash in the kidney bean. Pull the plunger back to aspirate. Insert the needle and flip the bottle to retrieve the medication. Draw up to the amount of medication the doctor ordered. It may take a while because you'd want to be exact. Tap the tube to remove any air bubbles. Once you've drawn the proper amount, you may recap the needle using the scoop method. Remember to always ask the patient if they have any allergies and if they have tested positive for tuberculosis before performing the test. Now let's view a live demonstration in a busy office.
Hi, my name is Kathy. I'm going to be your medical assistant for today. Can I verify your first last name and date of birth?
Sí, sabes español, nomás hablo a bit of English.
Sí. Yo me llamo Kathy, voy a ser tu asistente médica para un video. Puedes verificar tu nombre y tu fecha de nacimiento.
Rodríguez, junio 15, 2007.
Ok.
Gracias.
Entonces, ¿has agarrado la inyección para la tuberculosis?
No.
No. Entonces, ¿no has sido positivo para eso?
No, nunca tuve una inyección de eso.
Ok, entonces eso te lo vamos a hacer hoy, ¿ok? Va a ser aquí, en tu brazo. Se va a poner de nuevo una aguja y no la tienes que rascar, mojar, ni la puedes ponerle algo encima. Solo la vas a dejar así, pero tienes que venir otra vez en 48 horas. Si no puedes o tienes algo que hacer, si no vienes, lo vamos a tener que hacer en 2 days. No, porque si no vienes en 48 horas, lo vamos a tener que hacer de nuevo. ¿Sí entiendes? Ok, vamos a empezar, ¿ok?
¿Va a doler o no?
No, solo vas a sentir arder un poquito, pero se va a ir.
Here the MA is finding her site, cleaning her site, and performing the injection. Observe the angle at which she went in. Look at that wheel form. A few reminders regarding intradermal injections. The intradermal site is typically for TB skin and allergy testing. The angle at which you should inject your patient is at a 10 to 15 degree angle. If performed successfully, a small wheal should develop. It's recommended to observe the patient for 20 minutes after performing the injection. Patient will need to return 48 to 72 hours for a follow-up appointment after the test is performed. Patient care. Advise the patient to leave the site alone. Avoid using lotion and perfume on the site until the wheal has dissolved. Avoid scrubbing or rubbing the site as it can tamper with results. Thank you for watching. Good luck with your injections.